Hello everyone, in today's interview we have with us Zenclear Pharma Private Limited CEO and Zenurved Research Head Dr. Ramakrishna Aradhyula garu. Let's talk to him. Hello sir, hi, how are you doing?
Fine, fine. I'm on the top of the world.
That's great sir. Sir, in the previous video you have introduced a product called Countlet and you have also mentioned that it increases the platelet count if the man is attacked by dengue. So sir, we have another health issue also called thrombocytopenia. I'm very much sure that you are aware of that. Even that decreases the platelet count if the man is attacked by the disease thrombocytopenia. So, sorry. So, does this Countlet product work on this thrombocytopenia also?
Excellent. In fact, thrombocytopenia, the meaning itself is reduction of the platelet count.
Okay.
The condition of the reduction of the platelet count is called thrombocytopenia.
Okay, okay.
That means in a condition where the patient will have the less than the 1,50,000 platelet count is classified as the thrombocytopenia.
Okay.
Of course, in dengue fever, it goes further down to 10,000. Even in thrombocytopenia also, this count goes to 10,000 rupees. 10,000 platelets.
Platelets, okay.
See, before giving this introduction, I would like to tell you about this particular platelets and the importance of platelets. It is just described in our old epic stories. There is a character called Raktabija. He's a demon and Ma Durga kills him. See, the moment the sword is on the head of this particular Raktabija, the blood will come. Normally, the process of the blood is that moments it gets out, immediately it gets blocked.
Yeah.
That's called blood clotting mechanism. It's a natural defense process of the human body. But in case of this Raktabija, there is no clotting. The blood will come out and it spreads over the ground, and from each cell of this blood, another Raktabija will emerge.
Okay.
That is the problem of that particular story. I thought that this fellow must be having this thrombocytopenia because there is no clotting of the blood mechanism there. Just for introduction's sake, I told that Raktabija is having this particular problem called thrombocytopenia. Maybe this thrombocytopenia is a condition, definitely it's a much dangerous condition, it's a fatal. This is called hemorrhagic thrombocytopenia, where the blood will be leaked and there is no clotting process at all. If the blood is not clotted, when there is a requirement, when there is an accident, or when there is a mechanism where the blood should be clotted, then the patient will go for death. The bleeding may occur within the organs and then the bleeding may occur outside and everything. But this particular thrombocytopenia, normally patient will have certain conditions where if the platelet count goes down, the blood will be available in the vomit, the blood is available in the dental this thing and the nose, and there is the under the skin there will be a bleeding, and this thing forms red spots or purple color spots, which we call it bruising, and this condition normally occurs in the lower part of the legs. Through this particular condition, you can observe that this fellow is having a thrombocytopenia. First of all, why there is thrombocytopenia? The thrombocytopenia normally occurs because of the cancer, which we call it as bone cancer. See, there are three important components of the blood. One is red blood corpuscles, and second one is white blood corpuscles, third one is these platelets. Incidentally, all these three cells, they take birth from this particular bone marrow. If there is a condition where the bone marrow is defective, this particular platelet production is a big problem. In condition of this particular leukemia or bone marrow cancer or bone cancer, there is no question of this particular production of the platelets. In that particular condition, it will go down. Second thing is a sort of immunity problem. Autoimmune problem also causes this particular low platelet count. Third condition is in cancer treatment during chemotherapy and radiation, cancer radiation, this platelet count goes down because the therapy is to the bone marrow. No? The other reason it gets down. Let it be anything. Again, bringing back this particular platelets to the normal level is a vital and very important. Otherwise, patient may lead to the death.
Okay.
So, in this condition, these are the conditions what I told. There are three important conditions where the failure of this particular platelet count. Number one is trapping. Maybe it's a good condition, the bone is giving good number of platelets, but it is trapped in the spleen. It is not coming to the circulation. That is called trapping of this thing. Then there is a decreased production. If the bone marrow is not receiving sufficient nutrients and everything, it cannot manufacture or synthesize further platelets. Or of course in condition of cancer there is no question of production of this particular platelet count. Third condition is destruction. See, normally the platelet life is 10 days. If the platelet get destructed within 1 or 2 days, so there will be destruction. For example, 10 platelets take birth today and 20 if it get destructed, then the count will go down. Anything you have to have the maintenance of this between 4.5 lakhs to 6 lakhs per microliter of the blood. Retinue blood contains so much of platelets and everything. In this particular condition, the condition where you have to treat in such a way that the platelet count should come to the normal. That is a first and foremost important thing. So we have combined 3 important ingredients, which we consider as the world top ingredients. It helps to rise the platelet count. Number 1 is papaya leaf extract. See, the papaya, people will consider it is a waste leaf I am talking. The papaya leaf is a waste, people will think, but that particular wasted leaf or which we consider as a waste, that will save the human life.
To increase the platelet count.
See, normally people says that the Sri, no? See, in one of his poetry he uses that there is no waste resource, it's only wasted resource. So that means we are using it. The world recognizes the importance of this papaya leaf and they have extracted it, and papain is the substance where it comes out of this particular papaya leaf. Second ingredient is guduchi, or which we call it as Thrombocytopenia cardifolia. In Ayurvedic language it is called as Tipatiga, very very important substance that also is combined with this particular product called countlet. Third one is colostrum. Of course, we had number of episodes we made on this particular colostrum, and it's a wonderful product. It is made up of cow's first milk. See, now I will tell you the mechanism of action. This particular papaya leaf extract, which contains this papain, it stimulates the platelet production. The stimulation of this platelet production is through megakaryocytes. The megakaryocytes gives birth to this particular platelets. It acts on the megakaryocytes. It's a wonderful action. Second thing is it reduces the inflammation. Third thing is it neutralizes the free radicals. The free radicals are very very important. It got to be treated especially when the patient is sick, because free radicals will hindrance the oxygen to reach the cells. If you don't get the sufficient oxygen for the cells, lot of problems will come. So this is where this particular factor is very very important. Third one is it is powerful anti-inflammatory. And as far as that Tinospora is concerned, that Tipatiga or Guduchi is concerned, it stimulates the platelet production, and it's a very powerful anti-inflammatory where it reduces the spleen's enlargement, so that what happens is trapped platelet will be released in the blood. That is another mechanism of action. And third one is colostrum, which you know it very well. It's a powerful immune booster where you require the development of immunity even in condition of autoimmune response of this particular platelet reduction. This particular colostrum will take place. It takes care of that particular condition. And that is the reason colostrum is very very important. It develops the gut immunity and almost overall immunity, and another powerful action what colostrum is having, it again stimulates the platelet production because of that particular growth factors available in the colostrum. So these are all the important factors. That is the reason this product is very good product, and only one product in the world where it combined all the 3 ingredients which are important to rise the platelet count. The name is Countlet.
Okay. So, sir, who is not suffering from dengue or thrombocytopenia, can they take this Countlet tablet?
Yeah, very much. Why? Because as you said in the introduction that today it's because of the rainy season. There are a lot of mosquitoes and you cannot prevent it, the biting of that mosquito and everything you may get. And as I already told you, some symptoms will go unnoticeably. So you will not have the glaring or significant symptoms. So it is better to store one particular tablet, and even you can take it. It's just made up of cow's first milk and Tinospora and papaya leaf extract. Nothing will happen. You can always, I think I advise you to stock one bottle with you, because when dengue will come, we don't know. Or you may help the neighbor who is suffering with dengue and everything, because stocks are getting exhausted. Because of that only I am making this particular episode urgently. Why? Because I think 90% of the stock got exhausted from my store. Now only 10% stocks are available. Anyway, we are making sufficient stocks to meet the demand.
Oh, that's amazing, sir. And how do we get this product?
So it's very easy. Just call this number which is available under this particular video. My telecallers will answer your call, and the product is delivered at your doorsteps.
Okay, sir. Thank you so much.
Thank you very much.